Selena Hall. I'm a family nurse practitioner student, and today I am demonstrating the musculoskeletal examination of the lower extremity. So first we're going to start with an inspection, and I'm going to have the patient walk this way. I'm going to observe his gait, and I'm looking at the width of the base of his walk, the shift of his pelvis, and the flexion of his knees. Okay, and now I'm going to inspect the lower extremities, just looking over if there's any abnormalities, any swelling in the lower extremities, and any prominent bones, swelling, masses. I don't see anything. So next we're going to go ahead and start the palpation. So I'm going to have the patient turn, and I'm going to be inspecting, palpating the hip and the posterior iliac spine, which is directly underneath the dimples. And I'm going to start there. And I'm going to be, and this is right, the visible dimples that is just above the buttocks. And next I'm going to locate the greater trochlear at the level of the gluteal fold. So that would be right in here. And I'm going to place my thumb medially under the ischial tuberosity. And I would note that if the sacral joint is not palpable unless it was tender, and are you feeling any tenderness while I'm palpating or anything?
No.
Okay, and go ahead and take a seat. If the patient was having hip pain, I would have the patient lie on their side, and I would do an upper hip, have their upper hip flexed, and I would palpate the trochleocantric bursa, which is lying over the greater trochlear, and the ischiogluteal bursa over the ischial tuberosity, which is not palpable unless inflamed. Are you having any hip pain?
No.
Okay, so we'll move on. Next, I'm going to palpate the patient's knees. I'm going to palpate medially. No swelling observed. And I'm going to palpate the medial meniscus and the lateral meniscus. I'm checking for any sort of tenderness. Are you feeling any sort of tenderness?
No.
Then I'm going to palpate medial and lateral for the femoral condyles, and I'm going to palpate medially and laterally of the tibial plateus, and then I'm going to palpate the medial and lateral collateral ligaments, and trace the patella and palpate the patellar tendon to its insertion of the tibial tuberosity, and palpate the suprapatellar and prepatellar bursa. Are you feeling any sort of tenderness?
No.
Next, I'm moving down to the ankles, and I'm going to use my thumbs to palpate the anterior space for bogginess, swelling, or any sort of tenderness. Are you feeling any sort of tenderness? And palpating the Achilles tendons for any nodules or tendons. I don't feel any nodules. Do you feel any tenderness?
No.
And I'm going to palpate the posterior and the inferior calculus and plantar fascia for tenderness. And I'm going to palpate the lateral and medial malaria and the metatarsal phalangeal joints and grooves between the heads of the metatarsals. Are you feeling any sort of pain or anything? Next, I'm going to do the range of motion. So I'm going to first start with the hips. I'm going to have you go ahead and incline back like that. And for this, I'm going to place my hand under the patient's back, and as I'm going to have the patient lift their knee up and bring it to their chest, and I feel the patient's back lower onto my hand. Again, same thing. Okay, next we're going to do extensions. So I'm going to have the patient lie, and I'm going to have the patient bring their knee up, and then I'm going to have them turn their leg out and inward, and that would be abduction, and abduction would be towards the midline, adduction is away from the midline. Same thing on this leg. Adduction, abduction. Okay. Next we're going to try internal and external rotation. So I'm going to have you move your leg upwards and have you turn outward and across your body. Okay. Any sort of pain? Okay. All right. Go ahead and sit up. Next, we're going to assess the knees. So I'm going to lift your leg up and down, up and down. That is testing for flexion. Now I'm going to test for extension. So I'm going to have you stand up and you're going to squat for me. Good. Go ahead and take a seat down. Now I'm going to internal and external rotation with the knees. So I turn the leg this way and rotate it outward. Rotate it. Abduction, abduction with the knees. Now I'm going to test the ankles. So let me see your foot. We're going to test for dorsiflexion and plantar flexion. And now we're going to test the patient, do the special tests, and I'm going to test the patient's knees for effusion. If the patient had swelling in their knees, you would push and try to milk the fluid down. The patient does not have any fluid in their knees. So this would be a negative test. And then we're going to do McMurray's test. So I'm going to have you go ahead and recline back for me again. The patient will extend their knee up and then rotate out, rotate. And I don't hear any clicks, noises, or anything, so that is a negative test. Out, down. Okay. And then I'm going to test for the patient's ligaments injury, which the patient doesn't have any ligaments injury, but if they did, you hold the patient's calf and push down while you're pushing up with the foot. And the same on the other side. And the patient is healthy and no issues. Was there any pain felt or any tenderness?
No.
All right, thank you.